As the only academic health science center in the state, we are at the intersection where education, research, and clinical programs meet. And though it all starts right here on the UAMS campus in Little Rock, we understand the importance of reaching every corner of our state to meet the growing healthcare challenges and demands facing all Arkansans. UAMS is the state's largest public employer with more than 10,000 employees in 73 of Arkansas's 75 counties. UAMS and its clinical affiliates, Arkansas Children's Hospital and the VA Medical Center, together is an economic engine for the state with an annual economic impact close to $4 billion. With our contribution to education, research, and clinical programs, UAMS has a growing capacity to lead healthcare improvement in a swiftly changing and uncertain environment. Henry Ford once said, "Coming together is a beginning. Keeping together is progress. Working together is success." UAMS is made of many essential but equal parts, all working together towards a common goal: improve the health, healthcare, and well-being of all Arkansans. Here is a sampling of how togetherness produced many accomplishments in 2012.
The College of Medicine is at an all-time high this year with 12 NIH training fellowships that support graduate students and postdoctoral positions. Grants and contracts awarded to our faculty were more than $69 million, with 3 faculty members together representing more than $23 million. We developed a Center for Primary Care, achieved accreditation at 8 sites for our patient center medical home programs in family medicine, and opened a clinic in West Little Rock for internal medicine and OBGYN patients.
The UAMS Center for Distance Health has worked tirelessly to make sure geography is not a factor in one's ability to receive necessary health care. Angels, our high-risk OBGYN telemedicine program, has added 2 new clinical sites this year, bringing total sites to 36, with nearly 3,500 patient visits and 25 nursery sites. Angel Eyes served 219 families in 2012, a significant increase from 45 families in 2011. And for the first time, Angel Eye has been replicated outside of UAMS at Lehigh Valley in Pennsylvania. The Angels Call Center expanded services to provide after-hours support. This expansion, along with existing services, results in about 20,000 calls per month into the call center. Arkansas Saves, a telemedicine stroke program, added 6 new sites this year, bringing the total sites to 40. Other telehealth programs experiencing growth this past year were trauma, education, speech therapy, and Spanish interpreting, psychiatry, and rehabilitation services.
I'm one in 481 pharmacy students here at UAMS, a leader in pharmacy education. 2 new endowed chairs were invested. Dr. Holly Maples is the inaugural holder of the Sanders Chair of Pediatrics, and Dr. Peter Crooks was invested with the Simmons Chair in Cancer Research. Grants and contracts awarded to our faculty rose from 38th to 24th nationally, increasing from $3 million to $7 million in a single year. We were 1 in 4 in the nation to win a Student Community Engaged Service Award. Finally, we are excited to open the 12th Street Health and Wellness Center, an interdisciplinary center that allows for students to engage with the community.
The UAMS College of Nursing is working hard to meet the needs of our students, community, state, and country. This has been an exciting year. We have added a Doctor of Nursing Practice degree. This degree, along with the PhD program, are the only ones in the state. Our faculty was awarded $1.2 million in research funding, and we continue to be the state's distance education leader. In Arkansas, we have the only Hartford Center of Geriatric Nursing Excellence. We boast the highest number of faculty with national certifications and credentials, and we have the largest graduate nursing program.
The UAMS Center for Clinical Skills and Simulation Education is the state's only comprehensive adult medical simulation center with computerized lifelike mannequins for hands-on training of students, faculty, and staff. In the last year, the center has amassed 913 hours of teaching, testing, and training medical professionals. More than 5,800 students have benefited from training at the center in the last year. Nearly 2,000 standardized patients have been used to give hands-on lifelike training.
The UAMS College of Health Professions, now in its 40th year, has more than 600 students enrolled in various certificate and degree programs in 17 areas. This year, we established the UAMS Center of Dental Education, a bachelor degree in EMS, and hired faculty to begin a physician assistant program. These two areas received more than $2.4 million in grants and private gifts for scholarships, programs, and operations. The college's first advisory board was established, along with a new student welcome center and a student assistant fund in laboratory sciences.
We have 350 faculty members and a diverse student body of more than 300 students from across the United States and 19 countries. This year, we had more than 100 student dissertation projects and robust research in obesity, diabetes and birth defects, cancer, imaging and radiation therapy, healthcare delivery, and more. We established a certificate in regulatory sciences program along with a PhD in pharmaceutical sciences. Our students co-authored 86 published manuscripts, received 11 extramural training grants, and hold 2 major NIH training grants to increase diversity in graduate education.
UAMS Regional Programs is dedicated to improving healthcare throughout Arkansas, and in the last year alone we've reached nearly 175,000 outpatient visitors throughout every corner of the state. UAMS Regional Programs supports physicians and practices in rural areas, and last year opened the UAMS Family Medical Clinic in Magnolia. We're working to improve chronic disease and overcome health disparities by implementing the patient-centered medical home in all of our Family Medical Center clinics. The Center for Rural Health presented to more than 1,000 people and trained more than 300 healthcare providers through the health literacy program it launched last year. AHEC-trained family physicians are currently practicing in 120 Arkansas communities, reaching 66 of the state's 75 counties.
Student enrollment is at an all-time high, with 270 diverse students working within a variety of 23 distinct educational programs. Our faculty and staff generated about $8.9 million in direct and indirect extramural funding to improve public health. The Arkansas Center for Health Disparities was awarded a 5-year grant extension from the NIH of more than $5.5 million to improve access to quality prevention and healthcare programs for racial and ethnic minorities. Several new programs have recently been developed, including a certificate in regulatory sciences that began last August and a master's degree to follow. Proposals for a new PhD program in epidemiology and a web-based Master of Public Health are also being developed.
UAMS Medical Center served record-setting numbers of patients in the hospital, outpatient clinics, and emergency department. UAMS purchased the Carti facilities on the UAMS campus and became the exclusive provider of radiation oncology services. The UAMS Radiation Oncology Center is part of the UAMS Winthrop P. Rockefeller Cancer Institute, as it provides innovative, research-based treatment for thousands of pediatric and adult patients each year. Dr. Roxanne Townsend was named Chief Executive Officer of UAMS Medical Center and Vice Chancellor for Clinical Programs, coming to UAMS from Louisiana State University in Baton Rouge. UAMS expanded its outpatient clinics in internal medicine and OBGYN with the opening of the UAMS Financial Center Parkway Clinic. This clinic also has a sleep lab. In addition, the hospital opened 60 new patient rooms on the 9th floor. With the opening of the 9th floor, the hospital and PRI now operate 398 adult beds, 10 pediatric beds, and a 64-bed neonatal unit.
I first discovered a lump myself by doing a self-examination. My doctors immediately showed compassion and care. The doctors, the nurses, all the staff at UAMS, I never had a moment when I wasn't, other than feeling bad. Even when I felt bad, they made me feel good. They're doing the best in the world that they can do for each and every patient, with care, with knowledge, with love and compassion.
My husband Lance was diagnosed with plasmacytoma in his left scapula back in May of 2005, shortly after our son had turned 1. It was very apparent that the doctor in Chicago wasn't going to give us a lot of hope of any sort, and we needed to go where there was hope, and we did. I think I know in my heart that if we had stayed in Chicago, he would have died by December of 2008. That importance of staff and doctors and nurses looking at us as a family unit versus a patient who needs to be medically tended for. There was emotional needs that both my husband and my son and I needed, and they were met.
UAMS Northwest has grown to a total of 140 students across 4 colleges occupying space on campus. UAMS Northwest has secured gifts and pledges totaling more than $7 million. The UAMS Psychiatric Research Institute program in Springdale utilizes a portable telemedicine unit that allows for patient, physician, and resident consultations between Little Rock and Northwest Arkansas. We also have continued to work with the Schmeeding Center in Springdale and the Center for Children in Lowell.
I got involved with UAMS in 1998. My mom was diagnosed with dementia. They helped me so well go through all of that. And through that, I decided that it was time for me to give back to UAMS and to their research, bed rest, different things that I did for the rental center. It was a wonderful experience because I felt like that I was helping other people go through things that I had gone through, and so it was not hard for me at all.
Faculty and staff at UAMS continue to expand research programs by receiving grants and contracts awarded by NIH and other prestigious funding organizations. This year, UAMS grants and contracts totaled more than $127 million.
My physician, who is specially trained in geriatric medicine, is accessible, highly competent, and responsive to my needs. If it is something that she cannot readily deal with, she arranges for me to see another UAMS specialist who can. Teamwork seems to be key to the success of the program, and I'm grateful for that.
I've been a patient at the Jones Eye Institute for a little over 2 years, and I've been very impressed and pleased with the care that I've received. The staff has always been very courteous, thorough, and professional, and I wouldn't hesitate to refer my family and friends for evaluation and treatment. I want to thank Jones Eye Institute for helping me regain my vision.
The UAMS Center for Diversity Affairs operates to serve all components of the entire institution, including the 6 academic units, 7 institutes, and the UAMS Medical Center. The CDA played a primary role in program development and hosting duties of the 6th Annual National Conference on Health Disparities, which brought medical academia and professionals from all over the country to Little Rock. The CDA helped revitalize the Minority Faculty Development Caucus, which aims to increase the number of minority-led research projects and cross-cultural mentorships on campus.
My tremor was so bad that I quit going out in public pretty much because I couldn't drink or eat. I couldn't even write. Then my neurologist, after about 10 years, had read about the deep brain program here, deep brain stimulation at UAMS. After the surgery, it is amazing because immediately there were benefits from it. The tremor stopped. It really gave me my life back.
I sat with Dr. Smith, and then they sat with Dr. Smith, but that he was the first person that ever described to me what was happening to me on a physical basis, an emotional basis, a psychiatric basis, and a spiritual one. But his description to me that literally there were 3 giant nerve endings that I had. And those 3 nerve endings were my link to my children. And that those 3 connections had been severed on Christmas morning when my children died. And that repairing those 3 nerve endings was something that the Psychiatric Research Institute here in Little Rock could help me with. And, you know, and Arkansas is great. And I'm really glad I came here.
UAMS is implementing 4 key programs that will dramatically move us toward interprofessional teamwork for improved patient care. Patient and family-centered care is an approach to the planning, delivery, and evaluation of health care that is grounded in partnerships between healthcare providers, patients, and families. Nationally recognized PFCC expert Julie Moretz will join UAMS May 1 to spearhead this program. UAMS is in the process of a 2-year implementation of UConnect, a new integrated Epic clinical information system that will dramatically improve information sharing between outpatient clinics, pharmacy, lab, radiology, the hospital, and other patient services. With information on nearly 1 million patients, the new UAMS data warehouse created a virtual repository of health information that is helping clinicians and scientists improve patient care. A collaboration between the UAMS Translational Research Institute, Information Technology, and the College of Medicine, the data warehouse has more than 80 million lab records and 10 million patient diagnoses. The UAMS-led broadband expansion project, called Arkansas eLink, is the result of a 3-year, $102 million grant from the Department of Commerce. eLink, now nearing its completion, has provided increased bandwidth and equipment to support new and enhanced community services for more than 450 healthcare and education sites across the state. Arkansas is now one of the nation's most well-connected states, linking virtually all of the state's healthcare institutions, 2-year and 4-year colleges, and public libraries. But it doesn't stop there. It also benefits research, public safety, and has a profound effect on the state's economy.
As you've seen, the last year's been busy at UAMS. The experience of being at an academic health institution is transformational. In our case, more than 10,000 people work together toward a common quest to improve the health of all Arkansans. As we embark on a time of change in healthcare, we cannot alter our focus. We must continue toward the goal of providing safe, efficient, patient-centered, coordinated care, and by engaging patients, families, and communities as full partners. If we keep our patients and families at the center of our decision-making and care processes, we will make the right decisions. Quality of care will increase, efficiency will improve, and costs will go down. In fact, everything will get better. UAMS is truly unique in our ability to be the nucleus of training and educating future healthcare professionals while advancing the engagement of patients and families as full partners in their care and discovering and translating new knowledge into improved approaches to individual patients. Our individual pieces must work together as a strong, unified foundation from which we continue to grow this mission. And at the heart of it all is our patients and their families.